All right, good morning. I am Private Carter. Today I'm going to be teaching the basic combat lifesaver skills for soldiers. So there are two ways of thinking about this. There's the acronym of MARCH or the acronym of HABC. So today they mean basically the same thing and we're going to get the same results, but we're going to be using HABC for today. Here we are, we've been going on a patrol and we get into contact and our battle buddy gets shot. We're in a firefight. You're going to ask your battle buddy, can you return fire? Can you move yourself to cover? Can you apply self-aid? And if your battle buddy's not responding to those questions, then tell them to lie still, we're coming to you. And then before you go out there and get him, you have to get him or her, you have to make sure that you have fire superiority. So you're going to ask your tactical leader, do we have fire superiority? And if you do, then you'll go get him. And so our casualty has been shot, and once we have that clearance, we're going to run out. And the first thing you're going to do on the X is just look for, called a visual blood sweep. You're going to make sure that he's not bleeding, and the soldier could be he or she, but in this case it's a male mannequin. So if he is bleeding, you're going to look for blood-soaked arms. And if you see that, let's say this arm has blood all over it, you're going to put their tourniquet, not yours, but you're going to take their tourniquet and put it high and tight and over the clothing. So what that means is high on the limb and over the clothing and making sure that it's tight because you want to stop that bleeding. So tighten that as tight as you can, and then the windlass, the piece of plastic, you're going to spin 3 times at least. And that is going to cut off all that circulation so that wherever that bleeding is on that arm, it's going to stop, saving their life. So that's the only thing you do on the X, or the place where they're shot. The next step is you're going to drag them to safety to where you can start the tactical field care. So once you get that on, then you're going to drag them to safety. Once you're here under cover, then you're going to start your HABC algorithm. H stands for hemorrhage, and the thing to remember with hemorrhage is an acronym called NAIL. So NAIL stands for neck, axillary, inguinal, and limbs. If the tactical situation permits, you should don BSI, or your body substance isolation, or PPE. With the hemorrhage, you're going to remember NAIL. Neck is first, and that's going to be where you start your blood sweep, your physical blood sweep. You're going to reach under the neck, make sure your hands touch each other, and you're going to sweep up to check for blood. And you're going to say, do I see blood? Because that's going to help you remember what you're doing this for. You do that to the axillaries. Do I see blood? Do I see blood? Then the inguinals. Do I see blood? Do I see blood? If you see blood in any of these spots, you're going to immediately treat that. And that can be another skill that is demonstrated later. But for now, you're going to continue, assuming that you haven't seen any blood, going on to the limbs. You want to break these up into 4 segments so that you can pinpoint where that bleeding is coming from. Do I see blood? Do I see blood? Do I see blood? Do I see blood? Coming up to the upper limbs, do I see blood? Do I see blood? Do I see blood? I probably will see blood on this arm because it's the one that's shot, but I'm aware of that. Okay, once you've completed your H, your hemorrhage, then you're going to move on to A, which is airway. You're going to come up here and make sure that his airway is patent, which means clear or open. And to do that, you're going to look at the rise and fall of the chest. You're going to listen and try to feel for any breath. If they're unconscious, now is when you're going to do the head tilt chin lift. If they're conscious, you obviously don't need to look, listen, feel because you're aware that they're aware. But if they are unconscious, you'll do the head tilt chin lift, which is just grabbing here at the chin with your 2 fingers, grabbing at the head, palming it, and lifting it. So that's going to open their airway, make sure their tongue isn't going to choke them or prevent them from breathing. Now is when you would insert an NPA, which is a nasopharyngeal airway, a plastic tube into their nose. But for now, we're not going to worry about that. After airway, you're going to move on to breathing. So B, you're going to assess, are they breathing well, or are there going to be any obstructions to them continuing to breathe? For that, you're going to need to expose them. And they would have right now IBA, or their individual body armor, along with their uniform. You're going to take that all off. If you can, try to keep it intact, because we'll want to have that on them when we transport them. So you're going to take that off, and then with the uniform, if you have any troubles, you can just cut it open. You'll use your trauma shears that you'll have on you, or your knife or multi-tool. So after you expose the chest, you're going to scan and look for any problems with their chest. So you already, if you haven't done this yet, then you'll do that now. But the main part about this is you're going to press and open the skin for gunshot wounds. After you do that for the whole chest, if you see a gunshot wound, now is when you'll put an occlusive dressing or a chest seal on, and that is done on the bottom of the breath, or their exhalation. And that's more, we can talk more about that when we review that skill. But after you do this, then you're going to roll them over to check their back. Because if there's an entrance wound, then there's an exit wound. Or there could be an entrance wound on the back, but it hasn't come out yet. So you always need to check both. And this is something that will be reviewed later. Depending on their injuries or what mechanism of injury happened, you will not roll them or sit them up, but we're assuming that it was just a gunshot wound to his arm. So we're going to sit him up, and we're going to rake the back. Having exposed it, of course. And after raking the back, if you see any holes, once again, you put an occlusive dressing. If not, then you're going to put him back down. All right, and that is concluding the B, the breathing part. There's going to be more in your secondary assessment when it comes to breathing, like rate. But for now, that's all we're going to worry about. And the next part is C, which stands for circulation. So that is going to start with, first of all, just looking at his skin. If he's looking pale or cyanotic or like blue, that's a good indicator of what his circulation is doing. It's if he's going into shock. You're going to first check for non-pulsatile bleeding. So that is going to be any bleeding that's not arterial bleeding, or it's just like a slow bleed. And if you see that, you're going to treat that. The other part is you're going to change this hasty tourniquet to a deliberate tourniquet. Now, since you're undercover, you have more time to expose this. So having exposed this arm, you're going to see, oh, he's shot right here. So I still want to give him this much of his arm if we can. So I'm going to put another tourniquet on right here, 2 to 3 inches above that wound, but not on a joint. And I would have another tourniquet, and I would put it on right here, tightening it. And then only then, once it's tight, would I begin to loosen this. And I do that just in case this first one isn't as tight as I think it is, or if it's not going to work, I can closely monitor it and see if that bleeding is continuing or if it's going to stop. So after I slowly loosen this and I see, okay, this other tourniquet that I just put on is working, then I can loosen this completely. And then is when I roll or put it down just right next to that other tourniquet. But I'm not going to tighten this one. It's just going to be there on standby, just in case that tourniquet fails or we need another one. All right, so the next step is going to be checking bilateral radial pulses. And these are the radial pulses right here. I always remember that because the R kind of looks like, or your thumb kind of looks like a little R. So checking both radial pulses at the same time is going to help you to determine if he's getting adequate perfusion. Those are big words, but basically it means if his body is doing what it's supposed to. So if you both have the radial pulses there, that's a good sign. If not, then is when your medic will begin doing a saline lock to administer fluids. So that's the basic HABC algorithm that you need to know. There's other things that are going to be added to this, but this is a good foundation for you to start with.